Hey, welcome back. So today we're diving into something super interesting that's really changing the game in healthcare, you know? Like we've all probably used a symptom checker online at some point, right? To see what that weird ache or cough might be. Exactly. And that's actually the perfect segue into what we're talking about today. Dr. Maya AI and how it's fundamentally different from those traditional symptom checkers we're all, let's just say, familiar with. Think Ada, Babylon, WebMD, Buoy. You know the usual suspects. Well, it really comes down to its core philosophy and how it approaches a user's symptoms. It was pioneered actually by Dr. Katyali Srivatsa, who, get this, was digitalizing patient-centered care decades before all the tech giants jumped in to monetize it. He actually had the first symptom and sign checker website, but he stopped updating it. Yeah, it is. His reasoning was really profound. He realized that sharing knowledge about every single symptom and sign actually inflicted fear. It created this culture of dependency on doctors and undermined people's confidence in their own bodies and health. So his vision for Dr. Maya AI is deeply rooted in this idea of empowering patients, not making them more reliant. Okay, so this is where it gets really cool. Traditional symptom checkers like WebMD largely rely on what's called algorithmic branching. Think of it like a linear if-then decision tree. You answer a question, and based on your answer, it sends you down a specific path. Do you have a cough? Yes. Is it dry? Yes. Is it worse at night? Yes. You know? Exactly. And that's where they struggle with complex or vague presentations. Dr. Maya AI, on the other hand, totally abandons that algorithmic branching. It uses something called pattern recognition based on symptom triads. Instead of one symptom at a time, it requires users to input 3 symptoms simultaneously. So instead of just dry cough, you might input dry cough, feeling hot and cold, and fatigue. The AI then analyzes how these 3 symptoms interact with each other. It's designed to mimic the holistic, intuitive reasoning of an experienced physician. You know, how a doctor doesn't just look at one symptom, but how the whole picture fits together. No way! This is another massive differentiator. Most other apps aim to give you a preliminary diagnosis, a list of possible conditions ranked by probability. And that's where the worst-case scenario for a headache is a rare tumor anxiety comes from, leading to that cybercondra we talked about. Dr. Maya AI explicitly refuses to assign a specific disease label. It uses a super simple, actionable 4-color system: red, yellow, green, or blue. It gives you clear, direct instructions on what to do next. Red means rush to the hospital. Yellow means consult a pharmacist. Green means self-care at home. And blue? Well, blue is special, and we'll get to that in a moment. But the point is, it gives clarity without inducing panic. It's like, here's what you need to do, not, here's a list of terrible things you might have. Exactly, and that's a huge problem. Studies have shown that conventional symptom checkers often advise people who could safely manage symptoms at home to seek urgent or emergency care. It creates a massive burden on healthcare systems. Dr. Maya AI is explicitly designed to differentiate between minor and serious illnesses. It acts as a safety layer, intercepting those fear-driven hospital visits. Absolutely. And that brings us to the unique blue code. This is where Dr. Maya AI really shines as an AMR preparedness infrastructure. That's antimicrobial resistance, by the way. Most general-purpose apps don't have dedicated public health or epidemic defense mechanisms. Spot on. If Dr. Maya AI detects a highly contagious infection pattern, that blue code overrides all other colors in the system. It immediately instructs the user to isolate, and can even inform public health systems. Think about it. It can potentially sever the chain of transmission before someone ever enters a crowded waiting room or public space. It really is. And it ties back to that core philosophy we talked about: patient empowerment versus system optimization. Many top-performing health apps like Babylon or Ada are designed as business-to-business tools. They're optimizing hospital workflows, assisting doctors, or triaging patients into the existing medical system. Precisely. Dr. Maya AI, however, is focused entirely on human empowerment. Its goal isn't to create more patients for the healthcare system, but to help individuals understand when they don't need a doctor. It's about breaking that culture of dependency and restoring personal agency over health decisions. It's like saying, hey, you're capable of managing this yourself, and here's how. Exactly. And that was Dr. Srivatsa's original insight, you know? that overwhelming people with information about every possible bad outcome actually does more harm than good in terms of fostering self-confidence. So, to recap, Dr. Maya AI ditches the linear if-then for pattern recognition with symptom triads, gives actionable, color-coded advice instead of scary diagnoses, prevents unnecessary hospital visits, has this incredible built-in pandemic defense with the blue code, and ultimately, it's all about empowering the individual rather than just optimizing the healthcare system. Here's to hoping. It's a fascinating look at how AI can be used to genuinely improve health outcomes and empower people, rather than just adding more complexity. What a difference, right?